Hi, it's Dr. Sweeney. Thanks for tuning in. This is a bit of a weekend edition. Thought I'd tune in to talk about a condition called bipolar affective disorder, also known as manic depression previously. Just to really, for anyone that may be sort of dealing with it, or family members or friends, and just for general interest and knowledge. As a GP, we help look after people with a variety of mental health conditions, and bipolar affective disorder is considered more of a serious condition alongside schizophrenia. Bipolar affective disorder itself is a combination of episodes of depression where people can feel extremely low, withdrawn, not themselves, um, very slowed down, a lack of interest in anything. So all the kind of classic signs of depression, poor sleep, anxiety sometimes with that, but also then interspersed with phases of mania. Now, mania is when people become very sort of elevated in their mood. Their speech can be quite fast, quite pressured. Um, People can be very full of lots of a flow of ideas. They can be very, very energetic. Not sleep much. They seem quite hyperactive. Um, they often, in its more severe cases, can completely lose insight into the situation, so they do not realize how unwell they are, which can make it very dangerous for people that are suffering with that, and obviously very difficult for people around them as well. Um, and so manic depression is when you get fluctuations between the depressions, the low moods, and then the very high manic phases. And people can cycle between these. The frequency of these cycles can be very slow and long, or it could be quite rapid cycling as well, where people can change and swing between these two states quite frequently. Um, a sort of milder form of manic depression is called cyclothymia, which is sort of just like a sort of lighter, milder form where the peaks and troughs aren't quite as severe. That's my understanding of it. Now, it's important that people with the depressive phase of manic depression are treated with the appropriate medications. They use antidepressants sometimes, psychological therapies, but also one of the dangers is sometimes certain medications that are used to treat depression can actually push people into more of an elevated manic phase as well. So medications to help stabilize the mood are also used in manic depression just to try and sort of smooth out those troughs and peaks, those swings in mood. We actually have medications that can be used to stabilize the mood, and they take lots of different forms. And often the prescribing of these medications is guided by a specialist psychiatrist, um, sometimes with the help of a community psychiatric nurse, psychologist input, and the GP in the community. All can work together to help people maintain good mental health that suffer from bipolar affective disorder. Really difficult, really severe disorder. So if you think that yourself or anyone around you may be suffering with a sort of similar type of pattern, then definitely worth starting that conversation with your GP, perhaps having a proper psychiatric assessment and making sure that, because there are treatments out there that can really help to stabilize people's mood and make a huge difference to the quality of life. I hope that's been interesting and helpful. And until next time, see you soon.